Welcome to my channel, RX Sam 2020. Today we discuss a drug named Bisacodyl. About Bisacodyl is a derivative of triphenylmethane. It is used as a stimulant laxative drug. It works directly on the colon to produce a bowel movement. It is typically prescribed for the relief of episodic and chronic constipation and for the management of neurogenic bowel dysfunction, as well as part of bowel preparation before medical examinations, such as for a colonoscopy. It is usually sold as 5 mg tablets, 10 mg suppositories, or 5 mg pediatric suppositories. It is also available as a 37 ml bottle prepackaged enema containing a 10 mg delivered dose of liquid Bisacodyl. Medical use. Bisacodyl is used to treat constipation. It may also be used to clean out the intestines before a bowel examination surgery. It works by increasing the movement of the intestines, helping the stool to come out. What is? Laxatives, purgatives, or aperients are substances that loosen stools and increase bowel movements. They are used to treat and prevent constipation. Neurogenic bowel dysfunction, NBD, is the inability to control defecation due to a deterioration of or injury to the nervous system, resulting in fecal incontinence or constipation. It is common in people with spinal cord injury, SCI, multiple sclerosis, MS, or spina bifida. Dosage. Oral. Constipation. Adult. For short-term relief of occasional constipation or either chronic or of recent onset, whenever a stimulant laxative is required, 5 to 10 mg once daily before bedtime. Alternatively, up to 15 mg daily. Child, 4 to 10 years, 5 mg once daily before bedtime. Greater than 10 years, same as the adult dose. Oral. Bowel evacuation. It may take 6 to 12 hours before this medication causes a bowel movement. Adult, for the preparation of diagnostic procedures and in pre- and postoperative treatment, 10 mg for 2 doses given in the morning and evening, followed by 10 mg rectal suppositories enema on the following morning. Child, greater than 4 to 10 years, 5 mg in the evening, followed by 5 mg rectal suppositories on the following morning, greater than 10 years, same as the adult dose. Rectal. Constipation. Suppository. Remove the outer wrap and insert one suppository into the rectum. Adult. As suppositories, 10 mg once daily. Child. 4 to 10 years as suppositories, 5 mg daily, greater than 10 years, same as the adult dose. Enema administration. Enema contents of one bottle, that is 37 ml, rectally as a single dose. The patient should lie on the left side with the right knee bent. Gently insert the enema tip into the rectum using slight side-to-side movement. Point the enema tip toward the navel. Ease insertion by having the patient bear down, as if having a bowel movement, to relax anal muscles. Do not force the enema tip into the rectum. Squeeze the bottle to deliver the appropriate dose. Remove the enema tip from the rectum. Administration. Should be taken on an empty stomach. Take on an empty stomach for rapid effect. It will take between 10 to 60 minutes to work and therefore should preferably be used in the morning. it will usually have its effect within 30 minutes. If taken at night with warm water, it works by stimulating the bowel muscles and also accumulates water in the intestines. This helps to soften the stool and produce a bowel movement more quickly. The tablets should be taken at bedtime to produce a bowel movement the next morning. Do not take Bisacodyl every day for more than 5 days. You can take it with or without food. Contraindications: ileus, intestinal obstruction, acute surgical abdominal conditions, for example appendicitis, acute inflammatory bowel disease, severe abdominal pain associated with nausea and vomiting, severe dehydration, kidney failure. Rectal anal fissures, proctitis, or ulcerated hemorrhoids. Special precautions: do not take Bisacodyl tablets or use Bisacodyl suppositories every day for more than 5 days. Pregnancy: no, Bisacodyl is not safe or recommended in pregnancy, especially during the first trimester, as it may cause birth defects or a miscarriage in the mother's womb. Lactation: if your doctor or midwife recommends Bisacodyl rather than lactulose or fibogel, it's okay to use it while you are breastfeeding. It does not seem to pass into breast milk and is very unlikely to affect your baby. Elderly, safe. Except kidney failure. Side effects: fluid and electrolyte imbalance, abdominal pain, cramps, hypokalemia, low level of potassium in the blood serum, prolonged use, vomiting, hematochezia, diarrhea, rectal burning, suppository. Rarely side effects: colitis, dehydration, dizziness, syncope. Drug interactions: a high dose of Bisacodyl may increase the risk of electrolyte imbalance with the concomitant use of diuretics or adrenocorticosteroids. Enhanced gastrointestinal adverse effects with concomitant use of other laxatives. Decreased therapeutic effect and increased risk of dyspepsia and gastric irritation with concomitant use of antacids. What should avoid while taking Bisacodyl? If you are constipated, it's a good idea to stop eating pastries, cakes, and puddings for a while, as foods high in fat can make constipation worse. Do not take within 1 hour of antacids, milk, or other dairy products. You can drink alcohol with Bisacodyl. Brand names that are mostly prescribed by doctors: Alofen, Correctil, Cremafin Fresh, Dulcoflex, Dulcolax. Mechanism of action: Bisacodyl works by stimulating enteric neurons to cause peristalsis, that is colonic contractions. It is also a contact laxative. It increases fluid and salt secretion. The action of Bisacodyl on the small intestine is negligible. Stimulant laxatives mainly promote evacuation of the colon. Thanks for watching. Please subscribe and like this video.